So again, thank you everyone for joining us for our kickoff event today. We are happy to have you for our first event of 2021. To get us started, I would like to welcome today's facilitator, our PATH Program Director, Marilyn Ryerson. So please go ahead and begin.
Thanks, Jackie. Next slide. Today's discussion is going to focus on orienting you to the Partnership to Advance Tribal Health, which we often refer to as PATH. We'll ask you to be active participants during today's session, and we'll offer opportunities for you to participate in polling and encourage you to use chat throughout the session today. We have a chat monitor today, Carmen Alexander, and she will be monitoring that throughout the conversation. We'll get to those questions a little later. And we'll also provide an opportunity later in the session for audio questions and discussion. We will provide an overview of PATH to encourage our mission, or to include our mission and goals and how the work aligns with IHS strategic goals and objectives. We'll share more about PATH support that's available at the national and local levels, introduce local team members, and share additional information about upcoming opportunities. And then, as I mentioned, we will have time at the end to answer any questions for further discussion. Thanks again for joining us today. The next slide, we are going to, we'd like to better understand what you currently know about PATH. So Francesca McCall is our tech support for today's session. And Francesca, we're ready for you to launch the poll. If people would please participate in the poll that popped up on your computer screen. And thanks for sharing the results as we go here, Francesca. Haven't responded, you have just a few more seconds to participate. Great, thank you. You should now be able to see the results. It looks like many of you feel that PATH does provide assistance with data utilization to drive quality improvement and opportunity for peer-to-peer learning and sharing, communication, coordination, and collaboration between stakeholders, initiatives, projects, and teams, and access to a variety of experts and tools to support your priorities. So thanks for participating in the poll. And you can advance to the next slide. I would like to now introduce you to Dr. Jane Brock. She is PATH's Clinical Director.
Thank you, Marilyn, and thank you, everybody. I am just going to review a general overview of the PATH program. For some of you, I think this will be a review, but for some of you, this may be a new overview. So the Partnership to Advance Tribal Health is a pretty unique partnership between CMS and IHS, and it has the primary purpose of improving the health and health outcomes of the American Indian populations by improving the quality of care that's delivered through Indian Health Service hospitals. So the background of this partnership is that CMS, by statute, so it is written into the Medicare law, is required to devote a certain portion of its budget to ensuring that services paid for by the Medicare program and people who receive services through the Medicare program receive care that's appropriate and is in accord with standards of quality. So to meet that requirement, CMS contracts with organizations that have local presence to work with medical service providers to support their quality improvement efforts. So these contractors are now called NQICs, if that term happens to slip out of my or somebody else's mouth. It's the Network of Quality Improvement and Innovation Contractors. So the NQIC contractors support providers in about 4 ways. So we aim to connect providers working on quality with experts and with quality improvement resources. We provide direct technical assistance for implementing best practice interventions. We can perform data analyses that help track progress and guide quality improvement priorities. And then we also provide platforms for providers to learn from each other, which is absolutely crucial. So CMS has funded the PATH initiative as a task under for the NQICs, the Network of Quality Improvement and Innovation Contractors, to bring the resources of this NQIC program to IHS-run hospitals. So this Learning and Action Network that we're kicking off today is one of those opportunities. But PATH, in terms of our usual quality improvement work, is pretty unique because it is a partnership between these agencies, and IHS support is absolutely critical to success in accomplishing this work. So to that end, we've established a secure data sharing agreement with IHS headquarters. We include IHS Office of Quality staff in work group meetings that help guide our activities and ensure engagement. We are developing and will continue to develop trainings in collaboration with IHS on shared topics. Our work supports IHS staff to produce standardized policies and procedures that are relevant to our task focus areas and to be able to incorporate this into their policy systems. And we partner with IHS to provide this technical assistance. So next slide. This is our PATH mission statement. I'll just pause for a second so that people can read it. So in addition to the work that we think of as our traditional quality improvement support activities, the PATH team has both an opportunity and a requirement to build relationships with IHS providers and tribal members, and to support leadership practices that ensure alignment of hospital leaders with tribal government leaders, and to promote practices that are aligned with both CMS and IHS goals and supported by tribal leaders and communities. This is the PATH star, and it represents our mission. The circle around the star shows the importance that we place on collaboration and trust as fundamental to this work and to overall health and health improvements. Next slide. And so here are just some of the approaches that we are using to support positive change. So we know that we and everybody needs to be agile and flexible, especially now with the current healthcare environment. We aim to support evidence-based practices and implementation strategies and to capture the value produced by them. We know that having capacity for analytics can help give local IHS facilities the capacity to do better improvement work, and that being transparent with our work and the data is important. And most important of all, we know that having your communities at the center of all this work is a top priority for everybody. So next slide. So here are the 4 PATH focus areas. These are aligned with the IHS quality framework and the IHS strategic priorities and goals, which we'll show next. But the first is to improve patient safety and reduce patient harms. And the second is to improve outcomes for people needing and receiving behavioral health services, including suicide prevention, with a special focus on substance abuse and specifically opioid misuse. The third area is to increase the quality of care transitions by addressing both post-discharge care and transitions between settings, and working to improve access to care, which includes increasing the use of telehealth services. And the fourth is responding to public emergencies. And I think this is such an interesting time to be thinking about this. You know, we've just been through this, living experience of the need for comprehensive and ongoing emergency preparedness. But the upside is that right now, there's just a ton of learned wisdom that's ready for harvesting and orchestrating into stellar best practices and the resources for sustaining those practices. So it's kind of hard to realize it's only been a little over a year ago that this title, Responding to Public Health Emergencies, would have meant, a set of concepts and documents derived from historical examples and based on sort of projecting theoretical scenarios. But right now, we just have such a wealth of knowledge, and we know that you all have a huge wealth of knowledge around exactly how we should go forward from here on. So we are looking forward to working with you and learning from your challenges and successes to codify a whole new level of public health emergency management strategies. Next slide. So all of our work is crosswalked between CMS priorities and the IHS strategic goals and objectives. IHS has 3 main goals, and each goal has several objectives, and within each objective are a number of strategies. So our work most closely aligns with goals 1 and 2. Here's just a few of our high priority support activities that are aligned to these goals and objectives within the IHS framework. So we're working with facilities to implement patient safety and risk management programs. We're working to ensure sustained compliance and accreditation processes. We're helping measure and improve care transitions. We aim to capture, codify, share, and evolve emergency management protocols, and to support programs that decrease opioid use and related adverse events. So I'd like to now turn it over to Sarah Leek, who is the PATH Programs Associate Director. Sarah.
Hi, thank you, Jane, and hello to all who joined. Thank you very much. For the second PATH project, Comagine Health continues to partnership with 3 quality innovation networks and 1 quality improvement organization-like entity, and this is to support at the local hospital level. These organizations are located near the Indian Health Service areas and have quality improvement advisors that are key contacts, and they provide QI expertise and local assistance to these hospitals. These quality improvement organizations have the benefit of past knowledge, a cultural awareness, established relationships, and they do have the proximity of staff to these hospital areas. So the quality improvement advisors will help PATH hospitals progress through the focus areas and phases of the PATH contract, and they'll leverage the collective knowledge of the IHS organizations, such as headquarters, area offices, and the hospitals, and also with our PATH staff and our backgrounds. We will consider uniqueness of each of the hospitals, such as their distinct geographical characteristics, tribal communities, culture, and the hospital leadership and staff of each. So our technical direct support can be within each facility, but we'll integrate and promote the opportunity to collaborate across facilities and areas on a more national platform. And this will be through tools, resources, outreach, and networking. Next slide, please. Your quality improvement advisor provides the local support for the hospital and the area office. They work alongside the IHS hospital and the IHS area office leadership to communicate and coordinate activities to meet collective goals. The QIAs assist staff to evaluate the needs of their community. They will coach and advise on developing and strengthening individual improvement plans to ensure clinical, operational, and safety standards are met, sustained, or even surpassed. So the QI advisor will introduce and help with assessment of tools, resources, and evidence-based practices to drive and help the hospital's improvement in healthcare. Next slide, please. So now we would like to introduce the quality improvement advisors working in the 7 Indian Health Service areas. So if any of you on the LAN call today are from the Billings area, IHS area office, or the hospitals, would you please add in chat those facilities that you are with? So Mountain Pacific Quality Health is a QIN in Montana, and it has 3 quality improvement advisors that work directly with area office and the hospitals. Allison Bishop is project support and a QI advisor. Sharon Phelps is a senior project manager, and I am a project manager and QA advisor for PATH. The PATH QIAs, along with our Mountain Pacific PATH project subject matter experts and our national design leads, are honored to once again work on PATH project and with the incredible staff that we have at Blackfeet Service Unit, Fort Belknap Service Unit, and Crow, along with the Billings area office. All right. Now, yep.
Go ahead, Sarah.
Yep, Natasha, I'd like you to introduce to the Great Plains team. And also, if you are from Great Plains, please chat in if you're a facility that is from Great Plains.
Hello, everybody. I'm Natasha Green, and I serve as the Great Plains Regional Lead for the PATH project. On my team, many of you will remember Tasha Peltier and Nancy McDonald, who both serve as Quality Improvement Advisors, and Tasha as a Community Engagement Advocate. We work out of the Great Plains, Quinn, which is located out of South Dakota, and we serve the Standing Rock Service Unit, the Quinton Verdict Facility, Pine Ridge, Rosebud Service Unit, and there's a little error on there, Sarah, but we don't service Winnebago. That was a part of our old contract, but we're happy to service Cheyenne River, Eagle Butte as our 5th facility that we coordinate with. So thank you, everybody.
And this is Carmen. We do have check-ins from Cheyenne River Healthcare Center Ops, Ricky Fast Horse, and Johnny Pearman.
And thank you very much, Natasha, for correcting that. And thank you for chatting in. All right, the next slide, Carrie. Would you please introduce yourself?
Hi, my name is Carrie Howard, and I am the Quality Improvement Advisor in Minnesota, serving the Bemidji area. I work directly with the Cass Lake Service Unit and the Red Lake Service Unit, as well as the Bemidji area office. I am honored to live very near all 3 of those facilities and organizations, and am a part of the community here with the people that I am serving. And I did notice there's a couple of folks that are from the Cass Lake Service Unit that are on the line. And so thank you for joining us today. And we look forward to seeing you in some of our additional LAN sessions.
Right, thank you, Carrie. Next, we have the Oklahoma City area.
Good afternoon, everybody. My name is Jimmy Norris, and I'm from the Oklahoma PATH team, and I work with OFMQ out of Oklahoma City. And I serve the Lawton and Claremore service units, and also on the Oklahoma PATH team, we have Lindsay Wiley and Jason Phelps. And I see that there are some folks on from Oklahoma, from the area office. We have Marjorie Rogers, she's on. Hi, Marjorie. And also we work with Tracy Patton out of the Oklahoma City office. Out of Lawton, we have Natalie Robertson, the quality director, and her team. She has Jennifer Walkeny and Katie Tompkins. They both are on the call. Thank you for joining. And from Claremore, the quality director, we have Taylor Morris, and then Jaleesa Lauderdale is also on the quality team. So thank you all for joining.
Thank you, Jimmy, for the introduction, and for all of you from the Oklahoma area that have joined. Next, we have the Albuquerque area. And again, please chat in. And Carmen, would you please say a few words?
Hi, good afternoon, and you can see the beautiful actual Albuquerque area behind me. We work with, or I work with the ACL service unit, Mescalero, Santa Fe, and Zuni. And I did see Daryl Miller, Mr. Miller from Santa Fe, and Ms. Colon from Zuni on. So if anyone else is on, please go ahead and chat in. And I look forward to continuing to work with you.
Right, thank you, Carmen, very much. And again, for those that have joined from Albuquerque area. Now we have the Navajo area, and Ann Timmons, who's our task order director. Would you please introduce yourself in the Navajo area?
Absolutely, thank you, Sarah. Hello, everybody. Yeah, Ann Timmons, I'm the task order director, but I also have been taking first steps with Chinle, Crown Point, Gallup, and Northern Navajo. Jennifer Moore, I see you on from Gallup, and hopefully there's some others on. It's good to see you and great to be working with you again. So I was taking these first steps while you all were doing your amazing work on vaccinations in the Navajo area, but I'm happy to, as we were staffing up actually at Comagin Health, I'm happy to kind of announce that from next month with my colleagues, Carmen, who you just met, and Valda, who you'll meet in a minute, along with a new improvement advisor, you'll be well taken care of for the next 3.5 years. Oh, great, Brandy's on from Northern Navajo. Hi, Jennifer. Great to see you. We are so looking forward to working with you.
Thank you, Anne, for the introduction and for all of the chats in from the Navajo area. And last but not least, for sure, we have the Phoenix area. And Velda, please introduce that area and yourself.
Hello, everyone. This is Velda Williams. I am from the great state of Arizona, and I am privileged to serve the Phoenix area facilities, including the Phoenix area office. And I'm thankful to see Dr. Ty Reedhead on the call, who is our area director. And I serve the Colorado River Service Unit located in in Parker, Arizona. I serve the Hopi Healthcare Center in Palaca, Arizona, and the Phoenix Indian Medical Center located as an urban facility in Phoenix, and the White River Apache Indian Hospital located in White River, Arizona. I am very honored to be a part of this team and look forward to working with you all. Thank you.
Thank you, Velda, and thank you all for your introductions. And it's great to see all these facilities and see the staff that are on the call and are chatting in. So I would like to now hand back to the facilitation to Marilyn, who is our PATH program director.
Great, thanks, Sarah. So on this slide, you'll see a variety of networking and learning opportunities for you and others at your organization to take advantage of. LAN sessions will cover a variety of topics and provide a forum for participants to learn from guest speakers and experts, participate in peer-to-peer sharing, practice new skills, and access implementation guides and resources. They'll be held the last Thursday of each month. The huddles that are listed are multi-week, short and length learning sessions that are focused on a single topic area. You may have participated in our vaccination huddle series that ended last month. Our next two huddle series topics are listed here, and they are accreditation and certification and a culture of safety series. Each series will be a standing day of the week and a time, though from series to series that will change. Next, you see listed on the slide that there will be a leadership fellowship opportunity, which is an opportunity for a small group of your staff to participate in a collaborative guided by healthcare leadership competencies that are identified by the American College of Healthcare Executives. The PATH Post is a monthly newsletter that it will include news and information, resources, stories from the field, and accomplishments. The first issue was sent last week, so please let your quality improvement advisor know if you didn't receive it or would like others added to the list to receive it as well. Lastly, on this slide, we have listed our PATH website, which will house tools and resources, upcoming event information, registration processes for events, and more. With that, we'd like to take a little bit of time today to hear what questions you have about what we presented today. So we can go to the next slide, please. And we just encourage you to use chat or unmute yourself and let us know what questions you have, or to share what you're most excited to learn about or what you're working on right now that you have a question about. So we'll pause and let you think about that and maybe turn it over to Carmen. Are there any questions that have come in through chat?
We do have a comment from Daryl Miller of the Santa Fe Service Unit. He is a current member of ACHE and very actively participating. So he is very happy to see us referencing ACHE and using those resources.
Great, thank you.
And I do also see a chat from Eleanor Morin regarding PCMH. Do we want to elaborate maybe a little bit on PCMH?
Sure, thank you. Natasha, are you able to chime in on that?
Yes, I can chime in on that a little bit. As was brought up before, so Hello, Eleanor. I think I've seen you at some of our other PCMH activities through PATH. So welcome back to the PATH project. But yes, we will be hosting some accreditation and PCMH huddles. We have some tools that are coming out, and we are collaborating with the Office of Quality at headquarters level on some strategic items to cover regarding PCMH. However, if you want to put into chat different topics, maybe some pain points that you're going through regarding PCMH, please go ahead, because that just helps us plan what will help you most with our upcoming activities. So please go ahead and type those into chat or come off of mute if you'd like to talk about that. But we have a lot of activities coming up and a lot of resources that are available. And as always, if you are looking for a resource, have a question as you're working through PCMH on any of the different topics regarding PCMH, feel free to reach out to your QIA, who can then help reach out to the PATH group so we can find the resources you're looking for or provide that coaching as needed. So Eleanor, that's perfect. Just getting started to all 5 pillars. That is perfect, because we have a tool that'll help you go through the standards, and we'll talk about what that looks like regarding each of those. So that'll be really great. Thank you, Eleanor.
Great. And I do see from Marjorie Rogers, she's curious to see if there's information on how the cohorts will be selected for the fellowships and when we might expect them to begin. So anything that we're ready.
Great, thank you. Alana is on the call today. And Alana, would you like to speak to that, or would you like me to take that question?
No, certainly I'm happy to help, and you can just definitely fill me in or correct me if I'm wrong, Marilyn. Yeah, good question. So the fellowship definitely is in the works of being created, and tentatively we have the date set for rollout as September of this year. So as far as the cohort facility or cohort selection, we are working with a couple different advisory groups to determine what the best process looks like. So if you have more questions, so you can certainly get a hold of myself or Marilyn or Carrie Howard.
Great, thanks, Alana. And if people have ideas on how to make the selections for the cohorts, please feel free to add them in chat or send an email. We'll post the email general mailbox shortly. So thank you for that question. Carmen, are there other questions in chat at this time?
There are not. I think I was going to make an observation that just the variety we see in chat is very indicative of how we work with facilities. Everyone has different needs, and that is something that we focus on, how to work through our PATH goals, but meet your needs and priorities.
Great, thank you so much. Anne chimed into chat, and Anne is our task order director. And she said she's excited to learn from all of you what positive changes you made during the pandemic and about your amazing vaccination work. And it was actually right before I was going to ask our PATH team to chime in into chat and share what you're most excited about with this work. And while we're waiting for that, just checking to see if anyone wants to get in the phone queue or if there's anything else we missed in chat, Carmen.
We're still waiting on chat. And Jennifer Moore says their vaccination rollout on Navajo Nation was an exciting experience, and we can't wait to hear you share. I did read the other day that Navajo Nation has vaccinated 50% of their adult population, which is just amazing, especially for anyone that's driven through Navajo Nation. It's quite extensive.
Awesome, thanks for sharing that. Well, this isn't certainly meant to be the end of the conversation, but certainly looking forward to hearing more successes and lessons learned as we move through the LAN series. So before we close today, we just wanted to share a little bit about what's coming next. So on the next slide, We do have upcoming events listed. The next LAN session topic is focused on readmissions. It's scheduled for May 27th. And then we'll soon be getting you information about the dates for the next 2 huddle series that are listed here on the slide that we talked about earlier. So please be thinking about who from your organization would benefit from participating both in the huddle series and the next LAN event. We're willing to add others to the mailing list, or certainly if you have a particular event that you would like a staff person, you're welcome to register them for a given topic area. Next slide. So thank you so much for participating. We would like you to respond to our request for feedback. We're going to post the link in chat. We will do our best to incorporate your feedback to improving future LAN sessions. And so feel free to add things in chat for improvements either to technology or processes, or add it right into the feedback assessment if you're able to access that. In follow-up, next week, we will be sending additional information about the event series, and stay tuned for the next newsletter as well. So I'll just check in one more time with Carmen before we close the event to see if there were any additional questions in chat.
We didn't have a question, but we did have feedback from Mr. Miller again. He is really looking forward to the huddle series and found the vaccine huddles very informative. So thanks, we appreciate that feedback.
Awesome. Thank you. Well, thank you all for participating today. We'll give you the gift of a little bit of time back in your day, so hope you can use it. Thank you again so much for participating, and this concludes today's webinar.